Hey, thanks everyone for coming. We're going to go ahead and get started. We're also waiting on Congressman Van Hollen, but we'll work him in as soon as he gets here. I'm going to be real brief. This is a real busy day. There are a lot of important issues going on, although I think there's probably a few issues like the health of the American people that are important, and that issue goes on irrespective of what else is happening. My name is Brad Whitehouse. I'm president of Americans United for Change. I'm also representing Protect Your Care, the group that has been fighting to promote Obamacare and push back on the myths and falsehoods from Republicans for a couple of years. We entered a partnership earlier this summer to go on offense on Obamacare. I mean, no longer are we going to sit around and let Republicans kick a law that we know is going to work, kick a law that we know is working. So Americans United for Change, Protect Your Care, along with Senate and House Democrats throughout the August recess have been on the offensive. In fact, it was the Republicans that were on defense on the question of health care during the entire August recess, when they weren't fighting with themselves, that is. So we're thrilled to be doing this today. Obviously, the presidential candidates, Cruz and Paul, and some of these other Tea Party Republicans are having a rally today on the defunding of Obamacare. Well, the defunding of Obamacare has got about, and shutting the government down, if that doesn't happen, has about 7% support from the public. So they should continue to advocate for that whenever they get a chance. What we're about today, though, is we're facing October 1st is when you can start to enroll in Obamacare. Obviously, January 1st when you start to get benefits. And what we're here today is to talk about those benefits, but also to denounce the efforts of Republicans to sabotage this law. You know, it's one thing, and Congressman Schakowsky, you were around, it's one thing to oppose Medicare Part D, to say it wasn't the law that we would have implemented. And then it's another to go out and try to stop people from enrolling. Democrats didn't do that. Republicans are actively trying to sabotage this law, whether it's proposals like to defund Obamacare or shut the government down, whether it's another repeal vote, whether it's another effort to undermine the law on the floor of the House, or whether it's going after the nonprofits who are trying to help people learn about the benefits and sign up, the so-called navigators. And it is abhorrent what Republicans are trying to do. And I think there's one reason, Senator, that they're doing this. They are scared to death that this law is going to work. They are scared to death that Obamacare will work, that it will eventually be popular, that people will get benefits, because it will destroy their entire worldview of government and destroy their what they've run on for the past several years electorally. So we're here to push back. We're here to say no more. We're going to promote the benefits, but we're going to go hard after the delayers, the defunders, the repealers, the people, and the sabotagers, the people who are literally trying to prevent people from getting health care. I mean, think about it. This is not any longer an effort to try to win an election. It's not an effort to win a case before the Supreme Court. It's an effort to confuse people and to deny people health care. And as the summer's gone on, all of their arguments have withered away. Rand Corporation, Kaiser have had studies to show that premiums are going down. Premiums are lower than expected. We've seen competition on the exchanges bringing premiums down in states like New York and California. Obamacare is going to be a tremendous success. Yes, there are problems, there are concerns. The public says implement and fix. About 60% say implement and fix. And about 57 to 60% say no on repeal. So, look, if Republicans and Jim DeMint want to continue down this road, they want to continue to alienate millions of the American people, that's an issue that can be taken up in future elections. But right now, there are millions of people who need access to affordable health care. There are small businesses that want to provide it to their employees. And by God, they're going to get it. It's going to work. And Republicans are going to rue the day that they continue to try to sabotage it. So with that, let me turn this over to Senator Sheldon, Whitehouse of Rhode Island, and then from there we'll hear from Representative Chris Van Hollen of Maryland, Representative Rosa De Lauro of Connecticut, and Representative Jan Schakowsky of Illinois. So, Senator Whitehouse.
Thank you, Brad. Thank you to Brad and to Americans United for Change for bringing us together, and I'm really honored to be here with my colleagues in government, Representative Rosa De Lauro and Chris Van Hollen, and Jan Schakowsky, who are great advocates and great legislators. Since the Affordable Care Act passed, Americans have seen the donut hole begin to close with $1,000 on average in savings per senior. They've seen the 26 and unders be able to preserve coverage with immense savings in worry and concern to both them and to their parents. They've seen lower cost growth in the American healthcare system, saving hundreds of millions of dollars. They've seen extraordinary reforms, often in Republican states, as the private sector has taken advantage of the pilot programs in the Affordable Care Act. And now they're about to see the insurance exchanges take off, providing affordable coverage to about 40 million Americans who weren't able to afford health insurance before, and providing transparency and fairness in health insurance markets that were basically characterized by backroom dealing and the cost you paid depending on how big your employer was. And if you didn't have an employer, you were at the back end of the line and had the worst cost of all. So what we're seeing now in Washington, I would describe as the frantic last gasp of the extremists as they see yet another good piece of the Affordable Care Act roll out, and probably the biggest one to roll out so far. It's a bit of a tragedy that they are involved in these extremist stunts rather than participating in improving our healthcare system. Everybody knows that we burn 18% of our GDP on healthcare, and the next least efficient country in the world only burns 12. The institutes of medicine say by improving the quality of our care, we could save $700 billion every year. Private sector companies in Republican states are working hard to solve those problems, and yet the Republican Party here in Washington is basically captive to the extremists and has, in its frantic last gasp, determined on a defund ultimatum. About the defund ultimatum, let me just say it's the dumbest idea I've ever heard. It's dishonest, and there's not a lot of Republicans that believe this is the right path. And that's what the Republicans are saying about it. So thank you very much for being here, and I'll turn it over to Rosa De Lauro, and she'll turn it over to Chris and on to Jen. Thank you.
Thanks very, very much, Senator, and good morning to everyone here today. Thank you for being here. Americans United for Change, protect your care. We're grateful to you for holding this event, for standing up for better health care, for affordable health care. That's what this is all about, is making sure that health care is affordable to American families. To my colleagues, Senator Whitehouse, to Congressman Van Hollen, Congresswoman Schakowsky, to you, Brad, thank you so much. And thanks for the advocacy of my colleagues here today. You know, 3 years ago, we worked hard to make the Affordable Care Act the law of the land. Quite honestly, 23 years I have served in the House of Representatives. It's one of the proudest votes that I have ever cast. I wasn't here for Social Security or for Medicare, but it's what you dream about when you sit in the House or in the Senate, that you have the opportunity to help to try to make a difference. So we are proud to see this law going into effect. As I said, it is transformative in the same way that Social Security and Medicare were in the 20th century. It builds on bedrock achievements to provide more security for the middle class, a better and a healthier quality of life for the entire community. It restores the link between having a job and having health insurance. It makes health care coverage affordable and, yes, accessible. It empowers patients and doctors again. And no longer can an insurance company say to you or to your child, we can't insure you. You're too big a risk. They went out of the risk business. And that is their job, to take on these issues when people face the challenge of an illness. It makes a number of important, long overdue reforms that for most people, it's just common sense. Men, women, children, no longer denied because of a pre-existing condition. I have a pre-existing condition. I'm a cancer survivor. No one wants to insure me these days. But now I don't have to worry if I'm no longer a member of the House of Representatives, that I have the opportunity to be able to get health care coverage. Women have the most to gain in this piece of legislation. We are no longer going to be charged more than men for the same coverage or denied coverage because they've had either a child or a C-section or been a victim of domestic violence. Young people, as the senator pointed out, can now stay on their parents' plan, get the help that they need. Seniors in the donut hole, which is now beginning to close. Pediatric, maternity care now covered. Access to preventive health services, cancer, STD screenings, contraception, no out-of-pocket costs. You know, when I just mentioned that I'm a survivor, and I'm here because of the grace of God and biomedical research. No one should survive by luck in this nation. The Affordable Care Act makes sure that they do not have to. The checkups are now covered. Consumer shopping for their families plan now benefit from unprecedented transparency. And I want to congratulate Senator Rockefeller and the Senate for introducing that legislation, had the opportunity to work with him. Doctors, nurses, healthcare professionals able to receive grants and loan forgiveness. Healthcare centers, community healthcare centers, 23 million people get their coverage through community health centers. That's where they get their care. And now we are doing something about making sure that they have the resources that they need to address people's needs. The exchanges is going to open, as the senator pointed out. Families will have more choices, more access to quality insurance plans in the future. There is so much good in this law that we are seeing it happen. You know, for the naysayers, premiums are coming in well below what people said that they were going to be. Medical loss ratio, where now you have to spend 80% of that premium on a person's health care. People are seeing rebates come back to them when that hasn't been the case. The Kaiser Family Foundation study found just last week that once the exchange operate, insurance premiums under the Affordable Care Act will likely be even lower on average than what the CBO predicted. Let me get to a final point. It is a little bit like, and I know my colleagues, Congressman Van Hollen and Congresswoman Schakowsky, would. In the House of Representatives, Senator, it's like Groundhog Day. It is Groundhog Day. We have now voted 40 times for this. What they want to do is to repeal. Get over it. The House passed it. The Senate passed it. The President signed the law. The Supreme Court upheld this effort. And boy, were they upset when that happened. Were they upset when that happened? And now they view that their only role is to defund it. It's not going to happen. The American people don't want to see it happen. They want to see this law implemented. They want to make sure that the changes are there to make sure that it works. That's our job. That's what we're going to continue to do. And they can go on as many times as they like, but they're going to be turned back. This law, it is the law of the land. It will be implemented, and it will make an unbelievable difference to American families in their ability to afford health care insurance for themselves and for their families. It is going to be, ultimately, this is about saving lives. And it's not about politics. It's not about a political ideology. Thanks for allowing me to be with you today. And let me pass off to someone who has spent a lot of time working through this issue, and that's my colleague from Maryland, Chris Van Hollen.
Thank you, Rosa.
Thank you, Rose, and it's great to be here with Americans United for Change to celebrate the huge benefits of the Affordable Care Act. And Senator Whitehouse and Rosa De Lauro have described those benefits well. Great to be here with Jan Schakowsky, who's been one of the great leaders in that effort. It will provide more affordable health care coverage to millions and millions more Americans. And my colleagues have gone into detail on the benefits. What I want to talk about is what the alternative is, because our Republican colleagues for years now have said they want to repeal and replace the Affordable Care Act. Not just repeal, but replace it. We've never seen the replacement. They've never brought a bill to the floor to replace it. And you know what their replacement is? It's back to putting the insurance companies in charge of health care, back to allowing insurance companies to discriminate against Americans based on pre-existing conditions like diabetes or asthma or the fact of being a woman. All those things they want to go back to. And I would just remind everybody that between the years 2000 and 2008, insurance premiums doubled while the profits for the top insurance companies quadrupled. And so we are now beginning to get those costs under control and provide greater benefits to more Americans. It's ironic, Brad, you mentioned the fact that Mr. Jim DeMint is going around the country trying to defeat Obamacare. We all know that the Heritage Foundation, way back when, was actually one of the authors of the idea that every American should take some responsibility for their health care, and that those who couldn't afford it would get a little help in the form of a tax credit. That was their idea for individual responsibility. That's why it became the heart of Romney Care in Massachusetts. And that's why they can't come up with an alternative, because Obamacare is based on the idea that they put forward. Now, as others have mentioned, obviously, we're willing to make adjustments as we put this piece of legislation in place. But the core of this is what's going to provide affordable care to millions of Americans. And our Republican colleagues are not interested in making adjustments to improve it. They've been clear about that. They just want to defeat it and turn the insurance business back over to the insurance companies. And the reason they're so desperate to try to try and defeat it now in October is not because they don't think it will work, it's because they think it will work. And once it works, all the scaremongering, all the misinformation they put forward will be exposed for just that, the misinformation that it was. Look, the same was true of Medicare. They're afraid that a few years from now, people will see Obamacare like they see Medicare. That's what they're most afraid of. And it will undermine and undercut their whole theory that the government cannot play any useful role in making sure that Americans have affordable care. So they started with repeal and replace. Years later, there's no replace, other than returning to the days when insurance companies could discriminate against Americans and make large profits doing it. We have a better answer. Let's move forward. Proud to do it. And with that, I'm really pleased to introduce my colleague, Jan Schakowsky, who's been such a leader in this for so long. Jan.
Thank you, Americans United for Change, and my colleagues we stand really on the verge of a great day, October 1st, when millions of Americans will begin to have the opportunity to learn about the kind of affordable care that they're going to be able to get. You know, I'm about to return to a committee meeting of the Energy and Commerce Committee, on which I sit, and I'm on the Health Subcommittee and help to draft language for Obamacare, which I do believe will be up there with Social Security, Medicare, and Obamacare as the great advancements in this country for the American people. And even as we speak right now, there are people attacking in that committee hearing Obamacare, and we are likely in the House of Representatives to have the 41st vote this week to repeal at least a part of Obamacare.
On the continuing resolution.
Yeah, on the continuing resolution. I am really mystified as to what the Republicans can say that would really justify repealing Obamacare. And we saw that this summer, and I thank Americans United for Change and all of the advocacy groups because it's so different than it was in 2010. As this legislation rolls out and people experience its benefits, not just hear the myths and the lies about it, they are standing up at hearings and saying to Republican members, but wait a minute, I am a victim of cancer. I want to be able to get the insurance that I need, to get the care that I so desperately need. Do you want to take that away? All the benefits that have been mentioned, they would snatch from people just at the moment that they're about to extend to the 129 million Americans who have pre-existing conditions. Frankly, I think that's an understated number because it's pretty hard to get to of a certain age, or even young people, or even children that are born with pre-existing conditions, to not give the insurance companies an excuse to exclude them. Those days are about to be gone. I can just picture the anxiety, the worry, the heavy load that Americans carry on their shoulders, worrying not just about the care for their diabetes or for their cancer, lifting off their shoulders. This is not Republican. This is not Democratic. This is Americans that are worrying about their health care. And so we've seen all the numbers already. 17 million children with pre-existing health conditions don't have to worry about being denied coverage. In America, being a woman has been a pre-existing condition. Over our lifetimes, we have paid about 48% more for health care, and no longer will that be true, and we can't deny maternity care. We can't consider a C-section or even pregnancy a pre-existing condition and a reason to charge more. We have seen just in the last month, 8.5 million Americans have seen rebates because now 80 cents out of every dollar has to be spent on health care. And if it isn't, checks have to go out, and 8.5 million Americans received them just last month. I want to say one other number. And that number is 25. I know that Ted Cruz from Texas is one of those leading obstructionists in the fight, so I want to focus on the number 25. We can implement Obamacare, we are implementing Obamacare, and cover at least 25 million more Americans, or we can put the insurance companies back in charge and look more like Texas, where 25% of the population is uninsured. I think the choice is really simple. Thank you.